Yes, good afternoon. We are starting our class. Ask your colleague to join. I think previously we have ended with two topics, malaria and tuberculosis. And today we are going to start with measles. So ask your colleague to join the class. We are going to discuss about measles today. So measles, it is highly contagious. Contagious means it can spread rapidly from one person to another person. So it is highly contagious disease. It is acute disease, means it is short-living. Exanthematous respiratory disease. So it is under the category of respiratory disease with characteristic clinical feature or pathognomic sign which is known as Koplik spot. So remember this word well, Koplik spot in measles. So characteristic sign of measles is Koplik spot. We are going to see that Koplik spot also in next slides. So clinically, measles is characterized by fever and catarrhal symptom of upper respiratory tract. So fever is the generalized constitutional symptom, and other symptoms of respiratory tract, upper respiratory tract like coryza and cough, they are there along with the fever, and it is typically followed by the rash. So in measles, as you can see here over in photograph, there are typical rash in measles. So these types of rash, it can be purpuric measles, according to the type of the measles, according to the type of the rash, hemorrhagic measles, atypical measles, and modified measles. No need to remember different types of the measles. Just remember clinical picture seen over here: Koplik spot, fever, upper respiratory tract signs, and typically it is followed by rash. So still students are joining. Ask your colleague to join the class. Yes, attendance will be taken. So we will go a little bit discuss about history. Measles virus, first it was isolated in 1954. And in 1958, measles vaccine was used in clinical trial. You know that currently clinical trial of vaccine for corona disease, COVID, is going on. So such a way, in clinical trial, vaccine as well as drugs are developed. So in 1958, measles vaccine was used in clinical trial. In 1963, finally, measles vaccine was licensed to use. So you can see that there is gap of 5 years. When the clinical trial of vaccine was started in 1958, license for the use of measles vaccine came in 1963. So it is not easy to develop the vaccine. It took almost 5 years to develop the vaccine and to get it licensed to use in public health. That was in that era. Nowadays, because of the advancement of the technology, because of the rapid procedures, so vaccines can be developed with in short duration, shorter than this duration also. So we'll see problem statement in world. It is still leading killer among the respiratory preventable diseases. It is endemic in all part of the world. Endemic means it is present in all parts of the world. It is present all over the world, but in a manner which is a limited manner, not a major public, being a not major a public health problem, but if epidemic occurs, it leads to the major public health problem. So whenever the susceptible children for disease are greater than 40%, who are the susceptible children? Susceptible children means who have not taken the measles vaccine. You know that in India, measles vaccine is it is given at the age of 9 months along with the rubella MR vaccine. So if the child has not taken measles vaccine, MR vaccine, then child becomes susceptible. If proportion of the such children, percentage of the such children are greater than 40%, whenever they are greater than 40%, means unvaccinated, measles unvaccinated children are greater than 40%, at that time measles epidemic can rise. But because of the proper vaccination coverage, in India as well as in world. It has not happened in recent past because vaccination coverage is very good. When introduced into virgin community, greater than 90% can be affected. So virgin community means who are susceptible to measles vaccine, who are susceptible to measles disease, who have not taken the vaccine, who have no protective immunity against measles. So when if it is introduced in this type of the community, greater than 90% of the people becomes affected with the disease. So such a disease which is highly contagious, if it is introduced into the persons in a community who are unvaccinated, suppose 100 persons are there and they are not vaccinated against measles, if any measles virus come into one person of that community, more than 90% persons will be affected. More than 90 persons will be affected. Such a contagious disease it is. Deaths due to measles in preschool children in developing countries 100 to 400 times than in US and Europe. So more deaths in developing country as compared to the developed country. And case fatality rate in developing country is 2 to 15%. Means case fatality rate means that is the percentage of the children or persons who die out of those who are affected. Suppose case fatality rate is 2%. Means if 100% of the measles are there, 100 patients of the measles are there, only 2% for 2 persons will die. In pre-vaccination era, almost 135 million cases per year were happening. Pre-vaccination era means when before the introduction of the vaccine, 135 million cases per year and 7 to 8 million deaths per year were happening. After the vaccination, this 135 drops to 30 million cases per year, and this 7 to 8 million death drops only to 5,30,000 death per year. That is also as per figure of 2003, and recently it has been dropped to even lower level. So in world, majority of the measles death, that is greater than 95% that occur where gross this per capita gross national income is less than $1,000. So poverty. In countries where measles has been eliminated, means due to vaccination, and the measles case have been eliminated. Measles is not longer a problem, public health problem, or it is not a endemic disease. Their cases are imported from other countries, which remain an important source of infection. Suppose in any country measles virus is not there, then it can be imported through transport, particularly through flight from other countries. Top 10 causes of death in children aged less than 5 years worldwide. It is as per 2000. You can see that measles is also there in these top 10 causes. Top 10 causes. Perinatal conditions is the first cause. Lower respiratory tract infection, diarrhea, disease, malaria, and measles is the fifth cause as death in under 5 children worldwide. Other causes you can also remember simultaneously: perinatal conditions, LRTI, this diarrheal disease, malaria, measles, congenital anomalies, HIV, pertussis, tetanus, and malnutrition. So this is worldwide, right? Estimated measles death rate in 2003 WHO region. Forget this recent outbreak. Way back recently in 2005, 17th March in Nigeria. Then in Korea, 9th February 2001, and in Ireland in 2000. So in 2000, 2001, 2005, there were the outbreak. So you can know that whenever outbreak suggests what? That more than 40% children are susceptible. Means vaccination coverage is low in these countries. So it leads to outbreak. In India, measles is still a leading significant cause of morbidity and mortality of childhood. So because of the measles, there is still a significant morbidity. Still many patients are suffering from measles. Still many children have measles outbreak. So still it is the cause of morbidity. Can you name the Gujarati name of measles? Gujarati name. What is Gujarati name for measles? Just write down in chat box. Only 56 students are, so still ask your colleague to join the class as attendance will be taken. What is Gujarati name for measles? Write down in chat box. Do you know the Gujarati name for measles? Many of you may have also suffered from measles. It is there in school age children. So in schools, many of your friends may have also suffered. Yes, Ori, not Achabda, it is Ori. Ori is measles, right? So Achabda is what? Achabda. Ori is correct name. Yes. What can be the name for Achabda? English name for Achabda? Can anyone guess? What is English name for Achabda? Many of you or your friends may have also suffered from this. Chicken pox. Yes. Not smallpox. Smallpox is Sitla. Smallpox is Sitla, and chickenpox is Achabda. So again, I repeat, smallpox is Sitla, which has been eradicated from world in 1979. Chickenpox is Achabda, and this measles is Ori. Right? So we are discussing Ori. Before immunization program, cyclic increase in incidence of measles were recorded every third year. So every third year there were increasing cases. Before measles vaccine was introduced in immunization program, but after immunization program, interval between cyclic peaks have increased and intensity of peak have been minimized. It means number of cases, incidence of the measles have decreased after immunization program, after introduction of the vaccine. Measles vaccine and immunization program. So this is reported cases. As you can see, that number of reported cases, no need to remember the figure, but you can see that number of reported cases have been decreased as the year progresses. Now, epidemiological factor. So agent here is measles virus, RNA paramyxovirus. It belongs to the paramyxoviridae family, right? Only one serotype of this virus have been known. So RNA paramyxovirus, only one serotype. That is good. That is good for development of the vaccine. If there are multiple serotypes, then vaccine development becomes difficult. As you can hear in corona disease, that many of the genetically different corona virus have been isolated in our country as well as in other country. There was one news that in Ahmedabad more than 20 type of the serotypes are there. So it is difficult to develop the vaccine whenever there are multiple serotypes of the virus are there. Cellular receptor for measles virus are CD46, CD156, which are there on human lymphocytes. So these are the receptor which can accept the measles virus. Measles virus in droplet nuclei invade respiratory epithelium and attack reticuloendothelial system. So droplet nuclei. So whenever any person sneeze or any person cough, so that can be in form of the droplet. So this droplet nuclei, when we come into the contact with these droplets, it invade our respiratory epithelium. So source of infection, only case of measles. Only case of the measles is the source of infection. There are no carrier state. There is no subclinical infection. Once you get the measles virus, you will always develop the measles. It is for sure. No subclinical infection or no carrier state. So in exam, if your measles is being asked, you have to write down this agent, host, environmental factor also. These are known as epidemiological factors. Infective material. So as you know that only source of infection is measles, person who is suffering from measles. So cases. And it is the basically a respiratory infection. So what are the source of infection? What are the infective material? Respiratory secretions, right? So secretions from nose, throat, respiratory tract during the prodromal period as well as during the early stage of the race. They are the infective material. So if any person comes into the contact of the secretion from the nose, throat, or any respiratory tract cough, right, to the person who is suffering from measles, then that can be infective material for that. Communicability, highly infectious during the prodromal period and at the time of the eruption. So highly infectious. We know that it has the high contagious. It is highly contagious. It can transport infection from one person to another person rapidly, speedily. So if any child is suffering from measles in a school, so it is if other children have not taken the vaccine, then they are all susceptible. They can all develop measles disease. Period of communicability means when this disease is communicable, means during which period this disease can be spread from one person to another person. So 4 days before the onset of the rash, first stop over here, 4 days before the onset of the rash. Suppose I have measles and I develop rash today, so I may be transmitting infection 4 days before, 4 days before from the today. So I am infectious to the another person 4 days before from today and 5 days after appearance of rash. So today I develop rash, I can be transmitting infection for next 5 days. So 4 days before appearance of the rash and 5 days after this appearance of the rash, I will be transmitting infection to other persons. Secondary attack rate depends upon the susceptible children. If the number of susceptible children means who have not taken the vaccine are high in community, then secondary attack rate will be higher. Host factor, age, virtually everyone can be affected, but in childhood it is more susceptible. In developing countries, 6 months to 3 years. In developed country, even more than 5 years. Even in India also nowadays, recently we have seen the cases of measles in more than 5 years, in more than 30 years also. In adulthood also we have seen the cases of measles because of the vaccination. So we have introduced vaccine into childhood, and so the age, it is called as age shifting. So in children they are become immune, and now old adult person who may have not taken vaccine previously, they are susceptible. So age is shifted to higher age. Now in higher age group also measles, cases of the measles can be seen. Both the sexes are equally susceptible, so it is not so that in male it will be more or in female it will be more. So it can happen in both the sexes equally. Due to usage of the vaccine, now measles vaccine is seen in old age group, which we have already discussed. So immunity, one attack gives lifelong immunity. So in viral disease, many of the viral disease, it is so that once you get measles, you will be immune for lifelong. You may have heard your parents or grandparents to be saying you that once you have measles or chicken pox, then in life you don't have to worry. So it will not happen again in your lifetime. So it gives you immunity, lifelong immunity. And secondary attack rate is second attack rate, not secondary, it is second attack rate is rate. Infant protected by maternal antibody up to 6 months. So up to 6 months, infant may not develop measles because of they are protected by maternal antibodies, and vaccination gives lifelong immunity. So vaccine is very much important in such disease. Vaccine is very much important. It can give lifelong immunity. Either you get infection, it can give you lifelong immunity, or either you get vaccine, it can give you lifelong immunity. So choice is yours, right? Better to get vaccinated. It's freely available in government setup. Mortality due to measles in malnourished children is 400 times more than in well-nourished children. So malnutrition is the risk factor because there are more death in malnourished children who suffer from the measles as compared to those who are well-nourished. Malnourished children exert the virus for prolonged period, so they are dangerous to the community. Environmental factor in temperate climate. In winter, it is the winter disease. So cases of measles are more commonly seen during winter, but many times after winter also, during April, June also these cases are seen. In epidemics are common in India during winter as well as during early spring after winter is over. So it is January to April, it is the period during which cases of measles are commonly seen in India. Epidemics are commonly seen in India. So how many students are there? 63 students. So we will take MCQ based quiz, right? On after the lecture is over, I will give you link link on the WhatsApp. Not immediately after, but I will design that and I will let you inform. So based on these answers, right, there will be also provision of the writing roll number on that quiz. Based on that, I will mark the attendance. So it is compulsory to attend the quiz also after lecture is over. So your lecture attendance as well as your attendance in quiz, both will be considered. Measles are particularly deadly in countries experiencing or recovering from the war, civil strife, as well as natural disaster. Socioeconomic conditions, so common in poor communities, poor countries, poor community, because of unhygienic condition as well as many other factors, because of unawareness. So poverty, it leads to malnutrition. Because of poverty, there can be malnutrition, and malnourished children are more susceptible to measles because there is decreased immunity. Cell-mediated immunity is decreased because of the malnutrition, and they are prone to severe measles. And because of that, there will be increased mortality. So socioeconomic factors also play a role in development of the disease like measles. In many other diseases also they have the role. So some diseases are more common in lower socioeconomic class. Many other diseases like diabetes, hypertension, they may be more common in higher socioeconomic class. Again, I repeat, poverty leads to malnutrition. Nutrition status of the child will be low, and that will be lead to decrease in cell immunity. And so due to that, they are more prone to severe measles and increased mortality. Transmission can be direct. So direct transmission by droplet infection or by droplet nuclei. Droplet means from any person who have sneezed or who have coughed. So whatever the particles of the respiratory secretion is coming in the air, they are droplet. Right? Portal of entry. So by a respiratory tract, an infection through conjunctiva can also be most commonly it is through respiratory tract. So this droplet can enter to other susceptible child or other person through respiratory tract, through nose and through mouth. Virus remain active and contagious in air or infected surface for up to 2 hours. So this virus remain in air for 2 hours, and it can remain in infected surface up to 2 hours, live for 2 hours. So if I sneeze, if I am suffering from measles, and if I sneeze right now, so whatever the sneezing secretion are there, they will be coming into the contact of the table as well as through laptop surface. If any person touch over this laptop surface or over the table within 2 hours, of my sneezing, then it can come into the contact with the hand of that person, and that person become infected when the hand is touching to their mouth or nose. Recipient of vaccines are not contagious to others. Incubation period 10 days. So here also incubation period is also you need to remember. Can you, before discussing incubation period, write down in chat box, do you remember the period of communicability? Do you remember period of communicability? I have explained to you. Period of communicability. Write down in chat box. What is the period of communicability for measles? Means if I am suffering from measles, I can transmit infection before and after. So how many days before and after? That I have explained you. Period of communicability. Write down in chat box. What is period of communicability for measles? I'm waiting for your reply. I have told you that if I have measles, I am suffering from measles, I have the rash today. I may be transmitting infection some days before the development of the rash and some days after the development of the rash. That is called period of communicability. You have forgotten. Try to recollect and answer in chat box. Meanwhile, we discuss incubation period. So incubation period is 10 days from exposure to onset of fever. First, just remember this part. So you have to remember in 2 parts. So this is first part. 10 days from exposure to onset of fever. So it takes about 10 days for the onset of fever. If I get infected today, it takes about 10 days to develop me the fever. So 10 days for fever and 14 days to appearance of the rash. Incubation period means it is the entry of organism and development of the sign and symptoms. So entry of organism today in myself, so it will take 10 days for development of the fever and 14 days for the development of the rash. So 4 days later, the development of the fever, there will be rash. Let me check whether you have answered. Yes, many students have answered, probably because of delay in transmission of the chat. I may be seeing it late. So before 4 days, yes, 4 days before the race formation and 5 days after the race. Yes, you are right. So two period of communicability is two-way. That 4 days before the appearance of the race and 5 days after the appearance of the race. So here also incubation period, it may be clear to you that 10 days from exposure to onset of the fever and 4 days to appearance of the race. Simply speaking, if any person has entry of measles organism today, it takes 10 days for the development of the fever and it takes 14 days for the development of the race. When measles virus is artificially introduced bypassing the respiratory tract, incubation period is 7 days. So if measles virus are introduced by a vaccine, by injection, bypassing the respiratory tract, incubation period will be shorter. It is around 7 days only. Clinical feature, there are 3 stages in clinical feature: prodromal stage, eruptive stage, and post-measles stage. Just understand these names. Prodromal stage. Prodromal means that is the stage before the race appears. So there are prodromal symptoms like fever. Then second is eruption. Eruptive stage itself signifies that there is development of the rash in eruptive stage. Post-measles stage. Now it is the stage for whenever the patient has resolved measles. So post-measles stage. We are going to see again prodromal stage. It begins 10 days after injection. It is characterized by clinical features like sore throat in prodromal stage. Remember this clinical features: sore throat, coryza with sneezing. Okay, so sore throat, in throat you can experience sore throat, coryza with sneezing. So there is lots of sneezing, fever, cough, bloodshot eye means red eyes. Bloodshot eye means red eyes. Photophobia. Photophobia is what? What is photophobia? Write down in chat box. Do you know what is photophobia? Photophobia. Meaning of photophobia. Does anybody know? Write down in chat box till we are discussing further symptoms. Complex spots. The pathognomic sign is complex spots. So again I repeat, in prodromal stage, sore throat, coryza with sneezing, fever, cough, red eye, photophobia, and complex spots. They are the clinical features. What is photophobia? That you have to answer in chat box. Complex spots, yes. Here, what are the complex spots? They are small red spots with the blue-white center found on the mucous membrane of the mouth. So in mouth and tongue, which appears 1 or 2 days before the measles rash appears. So in mouth, there are small red spots, just like here over here. Small, these are the red spots which are there on the mucous membrane of the mouth. You may find other better photographs for complex spot also. So again, you can see complex spot. It is not clearly visible in this photograph actually. So what is photophobia? No one has answered. I would ask you to answer about photophobia. This still answer is pending. Eruptive phase. So we have discussed about prodromal phase. That some symptoms, prodromal symptoms, sore throat, fever, coryza, sneezing, and now eruptive stage. So it's the name suggests eruptive stage. So here there is eruption. Eruption of what? Rash. It's characterized by typical dusky red maculopapular type of the rash. Here the rash will be red in color and maculopapular. So there are macule. Macule means flat lesion. Papule means small raised lesion. So maculopapular rays are there, and rash begins behind the ears. So they are behind the ears, beginning behind the ears, and spread rapidly within few hours over the face, over the neck, and then extend down the body. Rays may remain discrete. They are discrete, chuta chavaya, but often they become confluent and blotchy. So I can show the photograph of this rash. Here also red eruptive rash. Child has the bad rash caused by measles. They are very bad rash. Cough present at this time is due to bronchitis. If in eruptive stage also cough is present, mainly rash, then cough, and it is by inflammatory condition of the mucous membrane when it corresponds to the rash. Ordinarily, the race lasts for 4 to 5 days. This race lasts for 4 to 5 days. Within 4 to 5 days, they will resolve. Race fades in the same order of the appearing, means first of all behind the ear, then face, neck, and then over the downward, they will resolve, leaving brownish discoloration which may persist for 2 months or more. So there can be discoloration after the race and which may be persisting for 2 or more months. Let me check whether you have replied for photophobia. Yes, many students have replied. Sensitivity to light, yes. Sensitivity to light, eye pain due to exposure of the bright light, fear of the light, fear of the bright light. So it is phobia. Fear is correct. Photophobia. Phobia is what? It is fear. So because of the, you are correct that sensitivity, because of the extreme sensitivity to the light, person may be fearful to this light. Right? So that is called photophobia. So till now we have discussed prodromal phase, eruptive phase, right? Child has the rays covering child's arm and stomach. You can see in the photographs over the stomach, over the chest also, over the arms, over the face. There are rays. Maculopapular red colored rays are there. Characteristic rays over the child's buttock region you can see, and back during the 3rd day of the measles. Again, extensive measles rays. You can see macular region over the abdominal area. Extensive measles rays. Post-measles stage. So we have discussed 2 stages, that prodromal stage, eruptive stage, and now post-measles stage. So here child will have lost weight loss, and it will remain for a number of days. Then there may be failure to recover and gradual disorientation in chronic illness due to increased susceptibility to other bacterial or viral infection. If the child particularly is suffering from malnutrition, then recovery will be gradual, and there can be also more loss of weight because of the infection, other infections. There may be growth retardation, diarrhea, right? Then there can be some condition known as cancrum oris, pyogenic infection, candidiasis, reactivation of the tuberculosis. These are there in post-measles stage. But because of the development of the vaccine, as well as because of proper nutrition status, this may not be seen. Even if the child has taken vaccine, and child may develop measles, but it will be mild. Complications of the measles are secondary conditions and symptoms of the disorder caused by measles. They are what? These are the complications of the measles. Remember, we are discussing complication of the measles like pneumonia. So it is the infection of the lung, pneumonia, otitis media, infection of the middle ear, optic neuritis. Optic neuritis is infection of the nerve, optic nerve, conjunctivitis, deafness due to middle ear infection due to otitis media, meningitis. That is the inflammation of covering of the meninges. This encephalitis, subacute sclerosing panencephalitis, and death. Again, I repeat: pneumonia, complications of measles, pneumonia, otitis media, optic neuritis, conjunctivitis, deafness, meningitis, encephalitis, subacute sclerosing panencephalitis, and death. I am giving you 30-second time, 1 minute time around. Try to remember these complications. They are important. Try to remember the complications. You can repeatedly watch this video also later on. So try to remember this topic by repeatedly going through the discussion as well as through your textbooks. So we are moving further. So that is the risk. We are not going to discuss this. We will skip this part. Measles pharyngitis. You can see photograph measles pharyngitis in adult. Measles rash and conjunctivitis. You can see red eye conjunctivitis and rash over the face. Subacute sclerosing panencephalitis is the rare brain condition arising years after measles infection. It is caused by reaction to measles virus. And clinical feature of this subacute sclerosing panencephalitis, it is intellectual deterioration. So it is brain infection. So intellectual deterioration, memory loss, irritability, involuntary movement. There can be seizures and blindness. We are not going to see other, just remember the names of the complication, not going into the detail of the complications. Atrophy in cortex of the subacute sclerosing encephalitis. Histological examination, no need to remember these things, only just remember the complications, names of the complications of the measles. Now, last part is prevention and control of the measles. So what is prevention? What is prevention strategy for this measles? You can answer me. We have already discussed how you can prevent measles. Write down answer in chat box. How you can prevent measles. Write down in chat box. We have already discussed how we can prevent measles. Write down in chat box what you can do to prevent measles. I'm waiting for the reply. How can you prevent measles? I think it is taking time to reach answers written by you. So we are going to see this prevention and control. So for prevention and control, first of all, for management, diagnosis and treatment of the cases as well as contact. But for prevention and control, you know that immunization, that is vaccination. Many of you may have written answer already, but I am not able to get those answers right now in chat box. So vaccines, we have vaccines as well as immunoglobulin, but through the majority part of the prevention is it can be controlled by vaccines only, no need to give immunoglobulin, as well as health education to the children and elimination. So we are going to see this one by one. So for diagnosis, we have already learned about different clinical features of measles, like prodromal phase. In prodromal phase, there are the clinical features like coryza, cough, then sore throat, fever, and complex spot. Typical complex spots, these are the pathognomic features for measles. As well as in this eruptive stage, there are rash. So typical maculopapular red rash beginning behind the ear and approaching towards the face as well as neck and lower body. That are the pathognomic signs. So these clinical features only we can diagnose this measles. So again, there can be differential diagnosis for scarlet fever. There can be history of sore throat and leukocytosis, typhoid, typical rose spots. So measles rash cannot. We have to differentiate with the other disease. So rash present here in typhoid, they are typically rose spot rash. In allergic drug rash, there can be urticarial element. Urticaria can be there, persisting for longer time. In rubella, fine pale pink rash. Cervical, along with the cervical lymphadenopathy, and never end in discrimination. But here in measles, you can see complex spots, prodromal symptoms, and typical rash. They are the pathognomic feature, which is the differential diagnosis point for the measles. Treatment of the measles case. If already any child is suffering from measles, so it requires nursing care rather than drug therapy. There is no specific drug for measles. Physical, emotional, and therapeutic comfort is needed for the person who is suffering from measles and prevention of complication. So here, what nursing care? Isolation. You are now familiar with this word, isolation. So in viral disease, we need to isolate the child. In measles also for 7 to 10 days. And dietary care, good nutrition, oral hygiene, skin care, no soap in case of the eruptive phase, respiratory care, gentle blowing of the nose, as well as prevention of the decubitus ulcer. So in decubitus ulcers means the ulcers due to lying down position. So if any person is lying down for longer period of the days, longer time, so there can be ulcer. So we have to prevent this decubitus ulcers by frequent change of the position and isolation, as well as dietary care, hygiene, maintenance of the hygiene, skin care. These are the modes of nursing care. So identify, if there is case, we have to identify all contacts like we are doing in case of the corona. Is contact susceptible? Means if the susceptible means is contact have taken a vaccine. If the contact has taken vaccine, then contact is not susceptible. Then is contact immunocompromised? Immunocompromised means is contact suffering from HIV/AIDS or taking chemotherapy or taking steroids and immunocompromised. If any person is not taking such type of if not immunocompromised, then no action is required. If contact is not susceptible, means taken vaccine, and in contact is not immunocompromised, then no action is required. If the contact is immunocompromised, then we have to give immunoglobulin. If the contact is susceptible, means not taken vaccine, so we have to consider now age. Age is 6 to 9 months. Contact in 7 days. Contact within 7 days has occurred to the case, and offer immunoglobulin. Age is greater than 9 months. Contact, if the contact with the case is between 3 to 7 days, then we can also offer immunoglobulin. If contact is within 3 days with the case, then is contact immunocompromised, then we can give vaccine if the contact is, immunoglobulin if contact is immunocompromised. You can skip this complicated part, means age-wise part. If the contact is susceptible, then in majority of the contact we have to give immunoglobulin. You can see that in 6 to 9 months, and 9 months also between 3 to 7 days contact, between contact in 3 days. If immunocompromise is there, then immunoglobulin is to be given. If person is not immunocompromised, then only vaccine. So simply remember that is contact susceptible? If yes, and if contact is not immunocompromised, then vaccine. If contact is immunocompromised or early contact is there, then immunoglobulin. So prevention of the measles through immunization, it is the major mode of the prevention. Active immunization, so there are single vaccine and combined vaccine. Single vaccine was used previously, measles vaccine only. Means that vaccine is containing only measles virus, means for measles only. Combined vaccine means it is combined with other vaccines like MMR, measles, mumps, rubella vaccine. Okay, and MR vaccine, here it is not mentioned, but I can use, we are using MR vaccine. Right? We are using in India MR vaccine, means measles and rubella in government immunization program. MMR is also used in private setup. Passive immunization by immunoglobulin, but only with the active immunization we are there in government system. Passive immunization is not needed at all. And health education. So measles vaccine first trial was in 1958, license in 1963. We have already discussed. An improved vaccine was in 1968, and it was added in universal immunization program in India in 1985. So we are using since 1985 measles vaccine are used in India. So in your exam also short notes on vaccine can be asked. So for example, if measles vaccine is asked, you can write down all these things. Preparation, it contains Edmostone strain, Edmostone Jagraf strain of attenuated measles virus. Right? And it has passed through 69 chick embryo cell culture. It has been purified by the 69 passage in chick embryo cell culture. It is live vaccine, live attenuated vaccine, tissue culture type, and freeze-dried preparation. The strain is Edmostone Jagraf strain. We are using this, so no need to remember this type. Edmostone Jagraf strain. It is given subcutaneously, right? In aerosol form, it was given in trial. So just remove this. You do not need to remember this. Subcutaneously, it is given in outer part of the child's arm, 0.5 ml after reconstitution. And according to the schedule, national immunization schedule, it is given at 9 months. So we are giving 2 doses nowadays, MR1 and MR2. So MR1 is given at 9 months. It is given at 9 months of the age. And MR2, it is given between 16 to 24 months, right? So you have to remember both this, MR1 and MR2. MR1 at 9 months, MR1 at 9 months, and MR2, it is between 16 to 24 months. In epidemic also between 6 to 9 months can be given. Immunity develops after 11 to 12 days and it is lifelong almost. 95% protection can be achieved with this measles vaccine. So that is subcutaneous measles vaccine. How it is given? You can see that different route. BCG it is given by intradermal route, just in skin. Parallel to the skin, we have to keep the needle. So it is 15-degree angle, right? This BCG vaccine. MR or measles vaccine, it is given subcutaneously, just below the skin, subcutaneous region, subcutaneous layer. You can see subcutaneous layer. So here it should go up to this. DPT, hepatitis B, they are given intramuscular. So they are given to be intramuscular 90-degree angle. So here 90-degree angle is needed, subcutaneous 45-degree angle, and in intradermal, in case of the intradermal like BCG, 15-degree angle is needed. Reconstitution by distal water, right? And here phosphate buffer saline is also used in reconstitution as well as twin 18. They are the constituent of the reconstituent material. It can be stored, freeze-dried vaccine can be stored below 0 degree, but in PHC as well as in vaccination campaign, we have to keep the vaccine storage between 4 to 8 degrees centigrade. 4 to 8 degrees centigrade. Contraindication to whom measles vaccine cannot be given: into pregnancy, active TB, leukemia. So such type of the common condition into which patients cannot be given this measles vaccine, as well as immunodeficiency disease like dysgammaglobulinemia or patient on long-term steroid therapy. Means the patients who are on steroid as well as immunocompromised, they cannot be offered measles vaccine. Adverse drug reaction to measles vaccine, common and minor reaction. So vaccine reaction are common and minor, like mild measles can develop, but very rare. Fever, rash, pain, and swelling. Rare or serious complication like febrile seizures or thrombocytopenia, very rare. And due to programmatic error, suppose we are giving vaccine by wrong route or by wrong material is given, then it is called as programmatic error. So contaminated vaccine can lead to toxic shock syndrome. So contaminated, that is not due to vaccine, but it is contaminated. So programmatic error. Because of the improper storage, incorrectly prepared vaccine, wrong side, there can be vaccine-related adverse event. Combined vaccine, MR vaccine, MMR vaccine is there. Here also, Edmoston, Zagreb strain of measles, and for mumps, Gerilin strain, and for rubella, R8 to 73 strains are to be given. So again, it is same subcutaneous. It is given 2 doses. First dose is, remember, just forget about this. First dose is given at 9 months, and second dose is given at 16 to 24 months for MR vaccine. MMR, yes, it can be given between 15 to 24 months. Efficacy is 95%. Mild fever and rash, same thing. Contraindications are also same. Pregnancy, untreated TB, immunodeficiency, we cannot give this MMR vaccine. Passive immunization, just remember immunoglobulin, it can be given for passive immunization. No need to go into the detail about this right now. Health education is also one of the important steps for the prevention. So we can educate the people, like health education about corona is going on, using mask and everything in case of the corona. Here also, we have to give health education by these posters, by group discussion, role play, focus group discussion. Right? So these are the methods by which health education about prevention of measles can be given. But with the availability of the vaccine, to take the vaccine is major part. The role is limited over here in case of the measles. No, health education has the major role in many diseases, but because of the vaccination, vaccine itself can protect the community. So health education, one-to-one counseling, patient education through mass media at national level or through social media, the community and district, group teaching, extension, self-help group, and demonstration. If you remember, the measles rubella campaign was there before 2 years. So at that time, this health education has the role. It had the role to take the measles rubella vaccine. That we were educating the people that you have to take the measles rubella vaccine to your child who is under 15 years of age, 9 months to 15 years of age. We were conducting educational sessions in community, in schools, through this mass media, through the social media. You can see the video of Amitabh Bachchan related to MR campaign. So here there was the role of the education by various national platforms, social platform, by various video. You can see various video related to MR campaign. You can see in my channel also video related to MR campaign. You can search that many videos are there related to MR campaign process. It is there in this channel also. So that is the example of the health education in case of the vaccination program. So I think we have already discussed many things. So we will be ending. You can control notification is required. Quarantine measures, as we are doing in case of the corona. Supplementary mask campaign in camps that can be there. So just remember, just before ending, there were the WHO vaccination strategy: catch up, keep up, and follow up for measles elimination. Catch up means that we have to catch up the unimmunized child. We have to keep up, give the vaccine. We have to keep the follow up for this unimmunized children. So that is, just remember these three words: catch up, keep up, and follow up for elimination of the measles. So that is all about measles. Just write down your roll number. Write down your roll number in chat box. It will be required for attendance. Already many students have written the roll number in your name also. But write down, all of you write down once your roll number and send in chat box. As well as you have to attend this quiz, which I will notify to you later on based on this topic. And I will also take attendance from that quiz also. Write down your roll number. I'm giving you 1 minute. Within 1 minute, you have to submit your roll number. One student has asked that, sir, we have heard that measles are good for our health. It improves our immunity, sir. It is myth, or tell us about it. So, as it is viral infection. Any infection is not good for our health, right? We have to take vaccine. Vaccine is good for our health, right? So immunity, it cannot increase the immunity. It can just increase the immunity for specific immunity. Once you get the measles, you will be immune to the measles lifelong. But it is not advisable that you get the measles so that you will get the lifelong immunity. Ultimately, the protection is offered by vaccine. So in place of taking the measles, you can see that you are suffering from many symptoms because of the measles. Why you need to suffer from Koplik spot? Why you need to suffer from the rash, right? Which may be the discoloration of the rash will be persisting for many months. So why you need to take the measles infection and to suffer from such type of the symptoms? And there are also complications. You have seen the complications: pneumonia, otitis media, deafness. So it is not advisable to take the measles disease. In place of that, you take the measles vaccine. At the time of the childhood, measles vaccine is given, MR1 and MR2. That is advisable, and that will boost your immunity against the measles disease, right? Thank you very much.